I'm Dr. Karan Bhalla, practicing in Gurgaon since about 17 years plus now. My first CBCT was Osstem CBCT itself, which I've been using for about 1 year plus now. So when I was looking for a CBCT for my practice, that was about 1.5 years back, I was looking at things of image quality, the service, the FOV, whether it's multiple or what large FOV can cater. So that's why when I saw and compared multiple companies CBCT, I saw that Osstem was ticking all these three things in a very wonderful way. So that's why I opted for a Osstem CBCT. So I'm using Osstem CBCT T2 Plus. I saw the software very well versed. It was very easy to use, very user friendly. That made me very comfortable to use the software. I can understand CBCTs will give us an image. One, we have to see the quality of image definitely, but we also have to see how well I can use it, whether it will be easy to use or not. It's just like using an iPhone, if it's user friendly or not. But if the software is not user friendly, it becomes a lot of time taking, I would say a tedious process for the practitioner. Yes, definitely. I think so. In an average, we are looking at 60% of the patients are getting CBCTs in our practice, be it for implant practice, be it for TMDs, be it for my orthodontic treatment. I use CBCT in all areas of work, whether I'm looking at to place an implant or I'm looking for orthodontic tooth movement or even endodontic purposes. We are using CBCT seamlessly in all our patients. So earlier on, when we used to plan our, I would say implants and all, we used to send the patients to a diagnostic center. So we were much more reliant on the radiologist who is giving us the reports for the CBCT, and the slices were limited, obviously. But with the in-house CBCT, I could see, I could relate better, I could diagnose better, and that too in a very seamless way, in a very fast way. There is no time lag of sending the patient to the diagnostic center and then the CBCT used to come, and it used to sometimes takes a day for the report to come in. Over here we can see live, decide which implant we have to place, what are the complications that we are looking at when we are placing the implant, everything seamlessly and immediately. So when the patient comes in, he gets the CBCT done and we place the immediate implant and that very moment itself. CBCT is I would say a three-dimensional way of seeing it. It's not a 2D image. In a CBCT, I could see, I'll give you an example of an endodontic treatment. The canals and all are not visible in a 2D image. With use of CBCT, I could see the different accessory canals, how many canals are present, whether the tooth is fractured or not. All these things are not possible in a 2D image. So CBCT definitely played a very important role in the last 1 year plus when it came to our practice. Absolutely, no doubt. Because the service, any technology, we understand when we are investing into a CBCT, it's a good amount of money, a hard-earned money which has been invested. And if the machine is there and if someday it doesn't work, obviously it hampers your day-to-day routine. But if it has been hampered for a longer duration of time, then it also hampers your revenue. With the seamless service and immediate action, I feel Osstem CBCT is a good investment, I would say. I would say revenue, because after the in-house CBCT, we could see that we have increased the revenue in our practice, be it implants. Implants are very, very immediate. We do guided implants moreover. So our guided implants hardly takes about 25 minutes and we can place the implant immediately to the patients, and the patient don't have to waste time. Earlier on, about I would say 7-8 years back, when I used to talk to clinicians, I would say OPG is must for any practice. It's not an investment which you would first earn money from the patient and then invest into it. Any practitioner who is opening up a new practice should invest into a CBCT. Diagnosis is increasing day by day. The technology is evaluating. The diagnosis is actually evolving year by year. Integrating a CBCT, a three-dimensional imaging system, is a must in any practice at this point of time. If you are there to actually reap the benefits, I would say invest into one. Otherwise, you'll be always obsolete. So as a practitioner, we all have been knowing Osstem as an implant system. And with the implant system, I would say these days diagnosis is also very important. The quality, the service, be it their chairs, be it their CBCT or be it their implants, are seamless, and it actually helps us as practitioners to formulate a system into our practice of having the implants and the CBCT together and doing the workflow, I would say. So definitely it's been a wonderful experience since few years working with Osstem, and the kind of service I get, I would say any practitioner should get associated with the company. Since the inception of Osstem CBCT in my practice, I myself have seen a lot of changes in my workflow. So I'd highly recommend for any practitioner to invest into a CBCT, an Osstem CBCT, to have the good workflow in their practice.